Saskatchewan's latest HIV data reveals a record-breaking 237 new cases in 2021, a 30% increase from the 2020 numbers, putting the province at more than twice the national average.
It's unfortunate.
Dr. John Marco Pondo was on Saskatchewan's HIV leadership team. He says while sexual contact contributed to the majority of cases, needle sharing is still a primary driver.
Injection drug use, if you're not practicing safe needle use, even a single episode of unsafe needle use can be enough to transmit HIV.
Kayla DeMong with Prairie Harm Reduction, Saskatchewan's first safe drug consumption site, says the numbers are not surprising but heartbreaking. For 3 years in a row, this safe consumption site has been denied provincial funding, and DeMong hopes this spike in HIV cases serves as a wake-up call.
The more investment we can have towards this population, the better impact we will see in lowering those transmission rates.
But some frontline workers say we shouldn't lose sight of other risk factors. Dr. Larissa Kiesman works with HIV patients in Saskatchewan, and she's noticing the virus is also spreading widely in non-drug users.
To sort of isolate this as a problem amongst people who inject drugs it's not appropriate, and it's not the case. It's not what's happening.
Some experts say last year's high rate of sexual HIV transmission can be linked to a lack of updated sex education in the province, especially when it comes to talks around consent and STIs.
We know that with HIV, that knowing your status is the best possible way to prevent spreading the infection.
That's where testing comes in. Throughout the pandemic, Saskatchewan has seen a dramatic decrease in HIV testing. There were almost 79,000 tests performed in 2021, up slightly from the roughly 72,000 in 2020, but still down from the nearly 94,000 in 2019. The Saskatchewan government says it finds these transmission rates concerning, and it hopes its newly available self-testing kits ramp up testing and lead to early diagnoses. And if that's the case, advocates hope that resources will become available to help deal with the inevitable influx in infections. Jesse Anton, CBC News, Regina.